Good morning, everyone. We're just going to wait for people to populate into this meeting, and we'll be getting started momentarily. Just as a reminder, if you have questions, please use the Q&A button to submit them. Please do not use the chat. Thank you. Again, we're going to be starting in just a minute. Okay. Let me introduce, to kick off the proceedings, I'm going to introduce Patrick Young. Patrick, take it away.
Do we have any participants yet?
We do.
Okay. All right. Okay, so good morning and welcome to the Hackensack Meridian Health's first exclusive Braven webinar. My name is Patrick Young, and I am Hackensack Meridian Health's President of Population Health, as well as a founding member of Braven Health. Thank you for joining us today and for being a member of Braven Health. We really appreciate it. This webinar will focus on COVID-19 and COVID-19 vaccine. This webinar is to educate and inform Braven Health members about the vaccine and what it means for you. This event is not designed to assist in making or scheduling appointments. Just some housekeeping items before we get started. It is recommended that you use a strong connection that is hardwired if possible, not Wi-Fi. We don't want you to miss anything on the call. Use your computer, not your tablet or phone as well. That would hopefully make it more easy to use. And please mute your devices to ensure a peaceful event. If and when you have questions from the presenters, please type in the Q&A feature, not the chat. We will do our best to answer any and all of your questions. If we do not get to your questions, we will follow up with you via the event later. Please refrain from asking any specific personal questions about your health or side effects in regard to the vaccine. You should speak directly with your primary care provider to ensure the vaccine is right for you. Joining us today is Dr. Dan Vargo, Hackensack Meridian Health's Chief Physician Executive, and Regina Foley, Hackensack Meridian Health's Vaccine Czar, and nurse with Hackensack Meridian Health for decades. They will be leading today's webinar. Dr. Vargo, Regina, take it away. You're muted, Dan.
So thanks, Patrick, and thanks for the introduction. I'm going to start off by taking folks through a little bit of the symptomatology that you're likely to see with COVID-19. This is stuff that's been out in the public press since this started. I mean, we had our very first COVID patient in New Jersey, March 4th of 2020. So we've been living with this information for about a year now, folks. So, but, just to refresh, the symptoms haven't really changed much as we've gotten, more and more familiar with this, and millions of Americans have been infected. It's still the cough, shortness of breath, low-grade fever, muscle aches, vomiting and diarrhea, the famous loss of taste or smell. That tends to be a pretty common symptomatology that people are seeing. One of the things that is very different about the virus and the way it acts today from when we first started with it is the vast majority of the transmission of the disease right now has largely been from asymptomatic folks to asymptomatic folks. Although you can, as it notes here on the slide, see symptoms that last anywhere from 2 to 14 days. There are some folks that end up with something called long COVID or the long haulers, but it's also still a relatively short-term disease with the vast majority of people either being asymptomatic or mildly symptomatic. Only a small percentage of folks needing to go to the hospital. However, folks over 65 are the most likely group to have severe disease or require hospitalization. Let's go to the next slide. So what we tend to still ask folks to do to seek emergency care is if you have trouble breathing, chest pain or chest pressure, some mental confusion, inability to stay awake, which can be a reflection of a low blood oxygen, or clearly kind of bluish lips or face, and those are the types of symptoms that we really want folks to get to the emergency department as soon as possible. Next slide. So how do we keep from spreading this around? And again, this has been around for a year now, but it really hadn't changed. It's social distancing, about 6 feet apart. Make sure that you're in public, you're wearing a mask, good hand hygiene, cover your cough or sneeze with a tissue, then throw it away. Don't touch your eyes, nose, or mouth. And again, wash your hands a lot. One of the things that we found was really helpful in our health system was really exhorting folks to stay home. Healthcare workers are troopers. They'll work all day long, on one leg sometimes. And it was hard to get folks to say, if you feel bad, stay home. Because what we don't want is for you to be in the hospital and potentially infect your team members or patients. And so that's something that we've been really, really emphasizing a lot. Let's go to the next slide. Little piece here to remind people how to wear their mask. Make sure you cover the nose, the chin, make sure there's no holes or damage to the mask and that it creates a nice snug fit for you. It's recommended to have at least 2 layers in that. If you're using a cloth one, it should be 100% cotton. The thicker, the better. We actually like if somebody's coming to visit a patient in the hospital, we require that folks use what we call a 3-ply mask, which is 3 layers, a classic procedure mask that we would use in an operating room or anywhere else. And again, as we note, that wearing bandanas or a gaiter that you pull up over your face, that's okay, but it's better than nothing, but again, it's not something that we have folks wearing around in the hospital. Next slide. The exposure criteria and how long you isolate has changed over the last year because of one big thing, and that is the fact that we have lots of testing now. And so if you're in contact with somebody who's tested positive for COVID-19, and that's whether they're symptomatic or asymptomatic, but somebody who you've been in close contact, and what we usually mean by that is that you've been within 6 feet of them for at least 15 minutes, then without masks, then you should self-quarantine at home for 5 days and then get tested. If you don't get tested, you should self-quarantine for 14 days. The reason we say that 5 days is the time to get tested is from the day that you're exposed until about the 3rd day after exposure, it's really, really difficult to find, it is more difficult, let me say it's not impossible, it is more difficult to get a good understanding of what the test result means, because you may well have what we call a falsely negative test in the first 2 or 3 days after exposure. What we do know is that in days 5 through 7, there's a much higher likelihood that if you've been infected, you'll have a positive test. So that's why we ask folks to test 5 days after their exposure. And then again, obviously, if you develop symptoms, we want you to contact your medical provider. Let's go to the next slide. So now we've got this vaccine. What about this vaccine? The vaccine is great. We right now, as of this weekend, we have 3 approved vaccines. And this is the process they've gone through. And I think one of the reasons that we wanted to actually show you the phases of approval is so that folks feel comfortable that this didn't take shortcuts. We clearly have managed to do these studies in a very rapid period of time, but there weren't any shortcuts taken with this. So in the first phase of any kind of trial, and this is whether you're doing emergency use or anything else, is you get a group of healthy volunteers to find out one big question: is it safe? Is the drug safe? Is the vaccine safe? Then you do the second phase, where you're actually looking to find out more about what actually happens with the virus. And so in this situation with the vaccine, you're spending a little bit more time finding out other common side effects that aren't life-threatening. What happens to the blood? What happens in your blood when you get hold of this vaccine? What does the immune system do? And start to get an early feel of, can you be protected with this vaccine? It's not comparing it with people who didn't get the vaccine, but it's just saying, does it look like this creates some protection? And then in the third phase, where you do several thousand volunteers, and if I'm not mistaken, Regina, I think in both of these, all of these trials, there were all at least 30,000 people that were in the phase 3.
That's right.
And in that setting, you're doing what they're calling a comparative study, which is a controlled comparative study. And in that setting, you've got a group of people that get a shot that doesn't have any vaccine. You get a group of people that get a shot that does have the vaccine. And then you compare how well those two groups do. And then where you see the blue box here, phase 4 is when the FDA keeps looking at this over the long haul. And gosh, I mean, Regina knows this better than anybody. The amount of reporting we do to the state and to the CDC on all of the folks that we've been vaccinating. We're over 1 million vaccinations, or 1 million people vaccinated, getting close to 2 million total doses of vaccine given in the state of New Jersey. Every one of those shots, the data from every one of those shots is going into a big database where folks can look and see and then follow out over the long haul to see how well folks do with this. So the big takeaway here is there were no shortcuts taken with this vaccine. It's just there was a Herculean effort to get this done quickly. So let's go to the next slide. They've gone through a really rigorous process here to ensure the safety, effectiveness, and quality of the vaccine. We're monitoring, as we've mentioned, really closely. And one of the very, very important things here is you cannot get the infected from the vaccine. Will not give you the virus, and it can prevent you from getting sick. So let's go to the next slide. J&J just got its emergency use authorization, and this is something that we're really trying to make sure that folks understand well. There are some variations between the Pfizer, Moderna, and Johnson & Johnson vaccines in terms of their overall preventive effect against the virus. The Pfizer and Moderna are 2-shot vaccines that were about 90 to 95% effective at preventing getting sick with the COVID-19 virus. The Johnson & Johnson in the US was somewhere around 70 to 75%. The thing that's very similar between all of them is that all of them are about the same in preventing severe disease, hospitalization, and death, better than 95%. So that's the important thing. And the big difference here with the J&J vaccine that was just approved last weekend is it's a 1-dose shot. And we just mentioned this about the Pfizer and the Moderna. The thing that we know about these is that they're effective. We don't know how long they're effective. It's the same issue that we don't know right now relative to the length of immunity if you had COVID. It's one of the reasons that we are still advocating for folks who were infected with COVID to actually get the vaccine on top of it. There is good evidence that you have effective immunity from having been infected with and then recovered from COVID-19, but nobody really knows for sure because this is a virus that's only been around about 16 to 18 months at all, and we're still trying to keeping a close eye on that. Again, as we said, there's clear evidence that you've got immunity for some period of time, but we're still waiting to see how long that is, and then how much that is augmented by the vaccinations. All of these vaccines were tested in very diverse adult populations. None of them were tested in people under the age of 16. Let's go to the next slide. So what is a messenger RNA vaccine? What that is, and this is a complicated slide, the takeaway on this is you take a piece of protein and you use that protein to stimulate an immune response in the person that gets vaccinated. The material that the messenger RNA vaccines are using is what's called the spike protein. It lives on top of the coronavirus. When you make an antibody against the spike protein, it is what we call a neutralizing antibody, which means it neutralizes the virus so it can't continue to infect. So it's the most important antibody production that you get. So this isn't a live virus, it's just an important chunk of protein that lives on the virus. Let's go to the next slide. So we're trying to anticipate some questions in this slide deck, and one of the things that we want to make clear is the messenger RNA virus. It's just a chunk of protein, and all it does is stimulate an immune response. It does not affect our DNA or RNA, so it doesn't affect anything inside our cells. It affects things in the virus's cells, and it cannot give anybody COVID-19 because it's not a virus, it's just a chunk of protein. And this is the same sort of vaccine that we've used in Zika, rabies, CMV, influenza. It's a very common type of vaccine that we use. Next slide. The number of side effects are real. They're not really common. It's up to 30 to 40% of people will get some sort of mild to moderate side effect. That still means that 60 to 70% of folks won't get anything at all. But usually they're limited to a little bit of low-grade fever, some headache, some muscle ache. I will tell you, having gotten 2 doses of vaccine, the other thing that folks tend to get with these is they tend to get a sore arm at the injection site. The bottom line is that there were really no significant side effects over the long haul, and everything was studied for at least 8 weeks after the injection to see if there were side effects from the vaccine. Next slide. Who can receive the vaccine? Right now in the state of New Jersey, healthcare workers, first responders, long-term care folks, and then right now in that bottom one, the individuals at high risk, the current New Jersey inclusion is folks over the age of 65 and anybody over the age of 16 up to age 64 who have what we call significant medical comorbidities. Let's go to the next slide. And these are the high-risk individuals that are targeted. So if you have any of those sorts of conditions, if you're a smoker, if you're overweight, you have obstructive lung disease, cancer, all of those, you can see the list there, all of those qualify you under the current New Jersey conditions. And coming up here in March, over the next, probably in 2-week blocks, on the 15th, you see a group that's going to become eligible, which are pre-K through 12 teachers and support staff, childcare workers, a lot of our what we call essential workers in the community, public safety, local public and local transportation, farm workers, homeless folks, people who live in a shelter, and then moving forward, we'll extend the list of essential workers that we'll be reaching out to include the list that you see here. I'm going to let Regina pick it up here because she is the pro on where you get vaccines, how they work, and everything else. So Regina, over to you.
Thanks, Dr. Varga, and thanks for the introduction, Patrick. You said I'm okay with vaccines are. Being a nurse with HMH for decades, I'm like, oh my gosh, I used to be the young guy, not anymore. So thanks for tuning in, all Braven members. To Dr. Varga's point, we do have here at Hackensack Meridian, we have been vaccinating at our hospitals, starting with our own healthcare workers back in December. We've also partnered with the Department of Health and the New Jersey State Police at the mega site up in Bergen County. So we're actually managing and running that location in East Rutherford. It's actually at the Meadowlands racetrack. The racetrack was due to be demolished, but then a group of folks cleaned it up and got it vaccine ready. We're vaccinating anywhere from 3,000 to 3,400 people a day at that location, and they're mobilizing to ramp up to vaccinate about 4,000 people in the next couple of weeks. New Jersey has 6 mega sites. I don't know if any of the members know that already, peppered throughout the state of New Jersey, Morris County, Atlantic, Gloucester, Burlington, et cetera. And these mega sites, again, are, it's meant for massive distribution. Your second appointment at our location is made at the time of the first appointment. And you can see based on the slide there that beyond the acute care hospitals and some retail pharmacies, I'll talk about that in a second because I saw a question, is that these 6 mega sites have been very effective. Again, they're open anywhere from 10 to 12 hours a day. On our website, HMH website, there's a link to get over to the racetrack, the Meadowlands racetrack, or the Bergen County site. The newjersey.gov, I think it's COVID-19, COVID19.newjersey.gov has all of the mega sites where you can make an appointment. Don't feel that you shouldn't check this site routinely, because as additional product comes into New Jersey, there's high sensitivity to get the product to these mega sites to make sure that they have adequate and continuous vaccine availability. So other appointments do pop up. People cancel, God forbid they get sick, they don't show. And when those happen, then we make available additional appointments. So if you're on those websites, continue to be on them to secure yourself a slot. What I was going to make a comment, and it was a question that came up about how do I get a J&J product? So as Dr. Vargas said, there's 3 products in the New Jersey market now. Moderna, Pfizer, we're working with since December. J&J just hit the market over the weekend, actually, Monday, Tuesday. In the hospitals, we're working on a process to vaccinate inpatients that are to be going home or going to maybe a rehabilitation or a long-term care environment. And we should start vaccinating by the end of this week, those inpatients. We only have a limited amount. But then many retail pharmacies throughout the state have also gotten that J&J product. Again, the benefit is the storage requirements. It's only a refrigerator and is only 1 dose. So I would check with your local pharmacy to see if they are going to be involved with administering the vaccine. I know Rite Aids, ShopRites, and some other more modest scale, modest scale pharmacies are giving out that vaccine. So, and towards the end of the presentation, you'll see a couple of links that, oh, here you are already. So to learn more about the mega sites or to ask questions to the Department of Health, you'll see the Department of Health site there, which is the COVID19.newjersey.gov. And then for vaccine registration, you can go into and put your information into a database. And then as you, and I believe all Braven members would be eligible, then they actually are contacted by the state-run mega sites to be pulled in to say, you're eligible, please make an appointment today. So those are 2 very good resources for the Braven members to utilize. Go to the next slide. Dr. Varga, you want to pick it up here? Or?
Yeah, I'll talk a little bit about the variants here. You probably have been reading in the news about the COVID-19 variants that have started to occur. Let me just point out, there are at least 4 variants. There's the variant that arose in the United Kingdom and across Europe. There's a Brazilian variant, there's a South African variant, and a Nigerian variant. I would tell you right now that inside HMH at our Center for Discovery and Innovation, Dr. David Perlin and his teammates there have developed a rapid test to look at the potential, to look for potential mutations and emerging variants here. And guys, I think we've had variants in the state for some time. And we're going to end up finding way more than 4 variants. But what we believe right now is that the Moderna and Pfizer vaccines, as well as the J&J vaccine, one of the reasons the J&J vaccine was a little bit, and here we're talking about the difference between 72% and 66% when it was tested in Europe and tested here, was that they already had the variants in play there. And they still got the results about preventing against hospitalization, death, and severe disease. Since the Moderna and Pfizer vaccines were never tested at a time when we had lots of variants, we're not 100% sure how they function, but we still believe that that all those vaccines will be somewhat effective and protect against the virus variants. Next slide. Yes, so this is, I'm going to talk a little bit about this so that we can make sure that there's a really important message, particular to seniors. And that is that, we've been running a program for both hospital and physician office safety since COVID-19 started. There is no reason for folks to not seek care, either in their physician office, at an urgent care center, in the ED, coming for a surgery that you and your doctor have talked about scheduling, coming for a screening procedure like a mammogram or a colonoscopy. You should come for all of those sorts of things, because we have been going out of our way to make sure that everybody is screened for the possibility of having COVID. People are getting temperature checks as they come in the hospital. We are doing what we call terminal cleaning of every room after it's used, which means you can see the gentleman there. I mean, we literally clean down everything in a room and sanitize it before the next person comes in. So the hospital, the imaging center, the radiology centers, the urgent care centers, your physician office inside HMH, they are absolutely safe to go see. Absolutely safe, and we don't want anybody to delay care. I'll give you an example of what happens with that. We have a horrible statistic in New Jersey that we found right after the first big surge in the spring. As we were looking at some of the, the data that we collected in the through March, April, and May, when we first had our experience with COVID, we were finding that our EMS colleagues had a 500% increase in pronouncements of death at home that weren't from COVID. 5x, 5 times more pronouncements at home, meaning people that died at home because they didn't come to the hospital. And that's why we have spent so much time trying to get the message out to folks. It is safe to come to the hospital. It is safe to come for care at your doctor's office. It is safe to go to an urgent care center. And please don't delay care. You can go to the next slide. Regina, I'll let you talk about some of the resources here.
Yep. So you can see that for New Jersey statewide information beyond registration, to register at one of the mega sites to be vaccinated. There's a lot of FAQs on that. They update it, to Dr. Vargo's point with the variants. There's some updated information. There's more. I was on the site last night. There's information about now the J&J product. That's a great resource. That 1-855 number, that's a call center with the DOH. They are attempting to leave a message. I believe that their call response back rate is very high. And then for our own within HMH, same information. And we have our Hackensack Meridian Health.org /COVID-19. That's where you can find information, but then also it'll bring you, that site will bring you to the link at the Bergen County mega site that, again, we're partnering and sponsoring there. So, and I know there's been a couple of questions, that lines are, I want to wait, I'm going to wait till July till, the demand is lower. And I guess I would just say, please don't do that, right? Your health is a priority. So just waiting for the, the demand to lessen a little bit. Braven members are in a high risk category. We need to make sure that you get vaccinated. And quite honestly, the state of New Jersey is prioritizing for the next 2 weeks, every location that's vaccinating, full court press to vaccinate those seniors in New Jersey, ages 75 and over, that we prioritize them to get vaccinated within the next 2 weeks because the risk is so high. And so although it may not be easy to get an appointment right away, again, I would just encourage you to get on these sites to make your health a priority, because you can't afford, for those that aren't vaccinated and wind up in hospitals. I can tell you, Dr. Vargo and I have been on the receiving end that people get very, very sick in a very short period of time. And we do not want that to happen to you. And the vaccine is the best defense that we have. So please make your health a priority. Seek out your doctor, as Dr. Vargo just mentioned, proactively. If there's any issue going on, don't ignore it. Don't wait, or don't be fearful that because we are in a pandemic. The reality is you need care. You may need access to care. And then you also obviously want to seek out that vaccine. So those are just two resources that you have it's available for you to get vaccinated.
Okay.
Slide.
Thank you, Regina. So I'll go through a couple questions that came up and just ask Dan or Regina to answer it. One of the questions was that if I get the Johnson & Johnson shot, do I need to get a second shot? And that was one of the questions. I don't know if Dan or Regina.
Yeah, no, you don't need a second shot at all. It gets the full value of its immune response with just one shot.
Okay, great. Are there any other questions? If you do have any questions, we'd like you to put them through the Q&A.
Yeah, there's a question about, will this be a yearly shot? And the answer is we don't know. We're going to be watching this really closely. That's that phase 4 box that you saw on one of those slides. And there'll be folks who got the vaccine that they'll be studying the level of antibodies and the level of immune response that they maintain over the long haul. It's really very interesting. Some of these types of coronaviruses have actually created very long-lived immunity. The virus that this is very close to from a few years ago, called the SARS virus, and actually it was SARS, I guess it was SARS-1, this is SARS-2. But that virus actually had immunity that in many people lasted 18 to 24 months after you were exposed to it. That wasn't a vaccine. It was actually the amount of immunity you got, or the length of immunity you got after you were infected with the virus, assuming you recovered. So we don't know. It could be anywhere from 6 to 12 months worth to a much longer period of immunity. So we'll be studying that. I would anticipate, though, that given the impact this virus had, is that this isn't going to be a one-time vaccination or an every 5 to 10 year shot like a shingles vaccine or like a pneumonia vaccine, et cetera. I think this is going to be something that's probably going to be every 1 to 2 years.
Okay. So we do have another question. Does my PCP give the vaccine? The question is, when, do they or will they, and where do we stand on that?
Yeah, I'll let Regina chime in on this as well. But right now, the distribution of the vaccine is coming from the state to health systems and to other providers. And so right now, they're not going directly to kind of the independent physician office. We actually have registered several of our HMH employed physician practices as administration sites, but the amount of vaccine available has been, so limited that we've not really had enough to push it out to the physician practices. There are some clinic sites in the state that have vaccine. They're called federally qualified health centers that tend to be in more underserved areas of the state that have been given some vaccine to try to reach out to those communities. But I don't think, Regina, will see lots of vaccine in physician offices until summer. You know, President Biden said yesterday that he thought by May there would be enough doses for all Americans, just the question of getting them out to people. I would think by the time we get that much vaccine, we certainly could be able to use your primary care or your physician offices to administer the vaccine.
Yeah, agreed, Dr. Varga. For right now, the supply doesn't meet the demand, and that's what we're faced with. And once we get through that, I appreciate President Biden's commitment to May. That kind of let's get it out to everybody. Now it'll give the chance for the manufacturers to produce more. The J&J in particular is very nice to very easily managed in an office setting, and even Moderna to a certain extent. So I think in the future, I don't know by the summer, but I think towards the end of 21 here is that we'll see vaccine more readily available in physician practices, in clinics, that more neighborhood community based, as opposed to the intention of the mega sites was to get it out there. Let's just get the product, get it in one location, get it out there. Once that's done, and then if we need to have booster doses, as Dr. Vargas said, we're not there yet. We don't know if we're going to need to. If we do, my sense is the manufacturing companies, and there could be other products coming to the market. Right now, we're just managing 3. I have the availability of 3. There could be others, but they would be more neighborhood and community or practice-based distribution. Yep.
So one of the questions was, why should I get the vaccine if I can still get COVID?
Yeah, so one of the things that I think we're already seeing is that if you get the vaccine, even with the variants out there, if you get infected with one of those, with a variant, or even if you get infected with the COVID-19 we've been living with for the last year, the symptoms you get will be markedly lower. It's just, just remember, folks, the influenza vaccine every year is about 50% effective. Just think about it, it's about 50% effective. But if you get the flu vaccine and you get infected with the flu, the intensity and duration of the flu is much, much less. And so that's why you get the vaccine. Same sort of thing here. If you get the vaccine and you happen to get infected, remember they're not 100%, but they are really, really good at preventing death, hospitalization, and severe disease. So the one thing that we don't know about the vaccines, and it's one of the reasons that we at HMH are still strong believers in masks and social distancing, at least right now, is we don't know if people who have been vaccinated can actually carry the virus around and then transmit it to somebody. It seems unlikely, but that's not been proven definitively because we haven't had enough time watching these vaccines and looking at that kind of data.
Mm-hmm. A question had come in regarding cancer. They have a cancer history, and you too should be protected. Just because if you have a history of cancer, go and get the vaccine. If you're in active cancer treatment, you certainly seek out the direction of your oncologist, your medical oncologist. Dr. Varga and I work closely with them here at Hackensack Meridian Health. I can tell you, as soon as we started launching the vaccine back in December, right behind the healthcare workers, they were saying, these are my patients. I want them to get vaccinated. So, the medical community is fully supportive to protect the patients, whether you're in active treatment or not. I think you have to seek the guidance depending on, what treatment protocol you're involved in. But your medical oncologist only wants your health as their priority. So if you have a history of cancer, that doesn't preclude you. In fact, I'd say go and get the vaccine. That isn't something to say, oh, I've had it, I shouldn't get the vaccine. That it's one's not related to the other. Bottom line is you have to protect yourself.
So Regina, another question is, will the East Rutherford site give the Johnson & Johnson vaccine?
Yeah, good question, Patrick. And for right now, in the state of New Jersey, all of the mega sites are giving the Pfizer vaccine, the Pfizer product. That was the one that came to market first. Right now in New Jersey, that's the vaccine that we have plentiful amounts. We're getting consistent distribution of Pfizer, as is Moderna, just at a smaller scale. But all of the mega sites are giving out Pfizer. I don't believe we would move to J&J. Again, things change, but for right now, it's Pfizer only at all of the mega sites.
Okay, thank you.
Yeah.
Are there any additional questions from anyone on the call? This is a great opportunity to hear from Dr. Vargo and Nurse Regina Foley. They are subject matter experts. And so if you do have any questions, I'd like to just to encourage you to please send the questions through the Q&A.
So there's a question here that says, why risk taking the vaccine if the majority of people are actually asymptomatic? And I would tell folks that, first of all, there's no risk from the vaccine. The vaccines are incredibly safe. Some of the safest vaccines we've ever used. The risk of, even if, remember, the risk of being asymptomatically infected with COVID is that you can give it to people you love, people you know, people you come in contact with. I mean, you know, when we were first going through, and there was a lot of vaccine hesitancy as we started, even in healthcare workers as we started. And the message that that Regina, myself, and others kept reiterating is, I'm doing this for the people I love. I'm doing this for the people I love, not just for me, but for the people that I love, because I want those people, if they ever came in contact with me, to be at such low risk of potentially getting COVID from me. So that's why I'm doing that's why I did the vaccine. And I think that's why everybody should do it. Getting a vaccine is an act of grace to everybody you come in contact with.
Yeah. There was a question, Dan, about, and it's come up on previous communications, is for those Braven members, if they have family or themselves that have had COVID, you know, they've had COVID and well, I've had COVID, I'm not going to get vaccinated because I don't need to, I have antibodies, or the time frame, I had COVID and there seems to be this kind of myth out there, I have to wait 3 months, I can't get vaccinated in less than 3 months. Is there fact or fiction there that you
Yeah, and so the answer is we still recommend vaccination because we don't know how long your acquired immunity from recovering from COVID is. We believe we certainly believe it's protective. And I'm going to tell you, so if you take the variants out of the conversation, you know, the first time this disease popped up was in China sometime back in the fall of 2019. When we were looking at, has anybody gotten reinfected with the native strain of COVID-19? The number, when folks first started looking at that in the fall of this year, so right before we got the second surge, the answer was hardly anybody. I mean, folks, we've had tens of millions of people infected with this virus, and the number of people who are getting reinfected is trivial. It's really, really small. So the answer is, it looks like your natural immunity, your acquired immunity to this, if you've recovered, is actually pretty good, probably for up to a year, but we don't know for sure. Getting the vaccine is just like getting a booster shot. If you've got natural immunity and you get a vaccination, it'll just boost the immunity that you already have, whether you get 1 shot or 2 shots. So think of it as taking the vaccines like getting a booster shot. I think the other question, Regina, was, I'm sorry, what was the second part of your question?
just the waiting, you know, if they were COVID, they had COVID, do they have to wait the 3 months?
Yeah, that is mythology. Because what we are telling folks is, if you were exposed on the 1st of the month, we would not recommend you getting the vaccine until the 15th of the month, right? I mean, we want you to go through the isolation period of 14 days and then go ahead and get the vaccine. So once you've cleared your isolation period, you should get in line to get the vaccine.
Yeah, it's another good point you brought up, Dan, although it didn't come up as a question, is although we're hopefully at the tail end of flu season, right, is that we don't want to confuse, you know, if you're going to get a vaccine, you really need to give your body a chance, a 2-week grace period. So if you got a flu vaccine last week, you want to wait 2 weeks before you get the COVID vaccine. And again, we're at the tail end of flu season, but you just don't want to kind of confuse. You want that immunity to start and, from the vaccine to work. So you want to give your body a chance.
That's a really good question, because we've had a bunch of, there are a bunch of vaccines that seniors regularly take. Shingles vaccine,
Right.
the pneumonia vaccine you get periodically. With any vaccine, we recommend that 2, 3, 4 weeks separation between the next vaccine you take. So great point, Regina.
So another question was, and I think you might have covered this, but I think it's an important one, is when we get the vaccine, will we still have to wear masks? And I think it's an important misconception about wearing a mask, not wearing a mask, and why you want to wear a mask even after you get the vaccine.
Yeah, the only reason well, there's a lot of reasons, but the biggest reason that we're advocating it right now is because we don't know for sure what kind of carrier state somebody can have with COVID-19. Can somebody with immunity walk around with the ability to infect somebody else with COVID-19? And the answer is, we think it's unlikely, but we don't know for sure. And the safest way to be sure, for right now anyway, is to wear a mask.
Yeah.
Until we get enough people vaccinated. And I think that's what, you hear Dr. Fauci talk about that all the time. As soon as we get enough people vaccinated, that it's very difficult to spread the disease through the community, I think you're going to see masks for a while, just so that we can make sure that we're not transmitting.
Yeah.
Another question came in is, if someone had COVID, can they infect others? And I think that speaks to the 14-day isolation from when you identify you having it, right, Dan?
Yeah. And so the scientific data on this right now would tell you that if you were infected on the 1st of the month, that by the 9th of the month, the amount of live infectious virus that you're carrying around in your nose, your throat, wherever it happens to be, is virtually gone. Now, you can still see it out to 14 days. It's very rare, but that's why we put the 14-day window out there. You may well test. So, for example, you got a PCR test, a nasal swab, and you tested positive for COVID. You may have a persistent test positivity. That test may stay positive for weeks and weeks and weeks, but you're not infectious. And unless you are somebody who has something that's really immunosuppressing you, like you're on cancer chemo, you're on a drug for rheumatoid arthritis or psoriatic arthritis, something like that, then in that situation, you may actually carry potentially infectious virus for a longer period of time. We actually, for our folks who are what we call immunocompromised, I think, Regina, we actually have those folks, it's several weeks before we allow them to come back to, I think it's at least 30 days before after being infected, before we allow them to come back to work, just simply because they could be carrying, potentially, they still could be infectious, even though they've recovered. I would just put it in perspective, Patrick, we do not require our team members to test negative before they come back to work. Right. They do their 14 days and then they come back to work.
And one of the last questions is, and maybe Regina, for you, is, can you get the vaccine in other states?
Yep, I saw that. And the short answer is you can get the vaccine, if there's a vaccine available, certainly take advantage of it. The rule of thumb nationally is the states are allocated vaccine based on their residents' census. So in New Jersey, we vaccinate individuals that work and live in New Jersey. And that's part of I would say, our denominator. So wherever your residence is, your state residence, that's where you should get vaccinated. If you are, bottom line is Dr. Vargo and I want everybody on the planet to get vaccinated. So if you have that ability, certainly take advantage of it. The same vaccine is available nationally, Pfizer, Moderna, and now J&J. So it's not that some states get some vaccine and not the other. It's an equal distribution. The rule of thumb is get vaccinated in your home state, because that is built in the denominator of that state. Then the other side, if you have the availability in another to get vaccinated, certainly seek that out too.
Okay. So there are no additional questions. So I want to thank everyone for joining us today. And thank you for joining Braven Health. We hope you found today's webinar helpful Hackensack Meridian Health hopes to hold more of the Braven Health exclusive webinars like this in the future. So please stay tuned to your email for more information about future webinars. Stay healthy and stay safe. Thank you, everyone.
Take care.